age 40 as one example, do not activate vitamin D in their skin, even with a deep dark tan. And so
Really?
you could be 44 years old with a wonderful dark tan and small tan lines and still be miserably deficient in D. And so that's one of the absolute requirements in the Track Your Plaque program. Not to mention overall health, because some of the most
Is to supplement vitamin D? Is what you're
is to
saying?
supplement vitamin D. Yes.
Oh, okay. Yeah, I know a lot of research recently. I mean, the last couple of years have really shown vitamin D to be beneficial in many different ways, and some people had mentioned that you got to get vitamin D3 instead of vitamin D2 or something like that. But in general, you would say vitamin D is a very important vitamin to have.
I go a step farther and say vitamin D restoration is among the most important things you and I can do for overall health and for youth preservation.
Oh, okay.
Amazing things happen, Justin, when you preserve vitamin D. Well, I should say when you raise vitamin D levels to what I regard as desirable levels. And by the way, we aim for 60 to 70 nanograms per milliliter on blood work.
Okay.
And you can do that. For me, the dose is 10,000 units per day. So this notion of 400 units per day is nonsense. Now, by the way, in the Food and Nutrition Board's defense, they retracted that just recently, and
Okay.
they're upping their they don't have an RDA anymore, recommended daily allowance. Now they have something called an adequate intake, and that's 2,000 units a day. So even they are giving in to this notion that more D is necessary. Now, I live at 43 degrees north latitude, which is fairly north. This is Milwaukee,
Sure.
and I'm over 40, and so my requirement is 10,000 units per day. In my experience in my office in Milwaukee, though also drawing from people worldwide because I have people from all over the world coming to Milwaukee, the average requirement for a male is 6,000 units per day. The average requirement for a female is 5,000 units per day. But I will
Wow.
tell you, it varies widely. But wonderful things happen when you replace D.
Oh, yeah, I know. I mean, just reading a lot of the recent research, it seems like that's one of the. I mean, it's one of the neglected vitamins in over the last couple of decades, and it's just coming back into vogue, it seems. But thanks for that valuable information. And since we're talking about a little bit of supplementation here in diet, once again, we did have a couple of audience questions about diet, and one audience member here, Johan, asked what percentage of a person's daily calorie intake do you think should come from protein, carbs, and fat, respectively? And then what's your typical diet in a day? Give us a little bit of the food, some of the foods that you eat to remain healthy as far as health, heart disease goes, but overall health as well.
Well, it's sometimes tough to generalize for everybody
I
because,
know.
as you
Yeah.
know, yeah, there are different genetic types. All we have to do is look out in the mall or the street to appreciate
Sure.
that there's many different
I'm
sorts
just
of
saying, yeah.
people.
We're just looking for kind of rule of thumb, what's better,
Well,
what's worse.
Let me make this point that if we accept that the most common reason to get to heart disease, so I come at this from the heart disease question, is small LDL and all its friends and relatives, which would include low HDL, high triglyceride, high blood sugar. A pre-diabetic type of high blood sugar doesn't have to achieve pre-diabetic proportions. High inflammatory measures like C-reactive protein and high blood pressure. Those all cluster together. So this is a familiar theme. You see this all around us. This is becoming an enormous nationwide and worldwide epidemic as the fascination with low fat diets and whole grains consumes everybody, and so low carbohydrate becomes very important for the majority of people, but not everybody. And as an asterisk on this, what if you are a 138-pound male, a very slender male who has no small LDL but has his sole cause for heart disease, lipoprotein A, the most aggressive cause for heart disease. This is the genetic pattern you see, for instance, in people who have lots and lots of heart disease, and their uncle who had a heart attack at 48, and their dad who had a heart attack at 53.
Okay.
That is more often than not something called lipoprotein A. That person should follow a different diet than the person with a big tummy a high blood sugar, and small LDL. So I always have to qualify this by saying that your diet may differ for your type.
Oh, yeah.
But speaking generally, for the most common pattern, there's and particularly in the upfront period. So if you have a heart scan score, say, of 500, and you're just starting out, and you're 40 pounds overweight, your effort's going to have to be a lot harder than somebody who's done this, say, for 2 years, has shed 40 pounds of unneeded pounds, has corrected patterns. So there's also a time factor, how long you've been working at it. But I use a very low carbohydrate, as we talked about, a wheat-free, cornstarch-free approach. The only healthy fibers I advocate would be ground flaxseed and, to a lesser degree, oat products.
Nuts? What about nuts that contain
raw nuts? I'm not a big fan of meat, but I think people can do fine on a lean meat.
Okay.
Though I'm not a big advocate of cutting the saturated fat in your diet any longer. I was, but no longer. I think the data are quite clear now. A la Gary Taubes, good calories, bad calories, etc.
Yeah.
I think he's opened our eyes, and many others have, to this notion that saturated fat has been vastly overplayed, but it is still something of a factor.
Something of a factor.
Yeah, so a diet centered around vegetables, less so fruits, lots of healthy oils, unrestricted quantities, by the way, but not superheated, meaning fried, lean proteins, lean meats, raw nuts, and non-wheat fibers. That is the kind of the core program that we follow with great success.
Okay. Well, great. Thanks for answering that question. Now, here I have a little bit more complicated question, so I'm going to have to read it verbatim. And see what you have to answer here. Obviously, the pure EBT machines subject the patient to somewhat lower levels of radiation than spiral CT. However, I suspect no one is going to recommend that a healthy 20-year-old with no risk factors have this testing. At what point and with what risk factors does the value of having a scan become great enough for someone with the longevity expectations of those who, hang out at the Immortality Institute? So people, you understand the question? Some people who want to, say, live a long time, and they're trying to reduce risk factors for everything, including cancer, they don't want to get any radiation, even low levels, if they don't have to. At what point do you think the risk factors for heart disease warrant getting a heart scan?
Well, let me just say, first of all, Justin, that speaking in general, not to this one person,
Okay.
but speaking in general, I advocate males 40 and over, females 50 and over, all get heart scans. Now, let me clarify that, because there's a lot of misinformation being batted around. Recently, the New York Times and the LA Times both mucked it up quite well by confusing heart scans with CT coronary angiography, two entirely different tests, but they confused them, thought they were the same thing. If you have a heart scan on an EBT, electron beam device, you would get exposed the equivalent of 4 chest x-rays of radiation. So there is indeed a radiation price you pay.
Sure.
So you always want to be certain that the benefit you gain out of it is more than the exposure. But it's the exact exposure of a mammogram. So I think that's a price we have to pay. Perhaps in 3 years it's less, but right now it's 4 on an EBT device. It's 8 to 10 chest x-ray equivalents on so-called multi-detector devices. So spiral is what we used to call these things, but then they added numerous detectors to cut down on the radiation exposure and the time acquisition. And so you heard about 16 slice, and now the most common is 64 slice. On a 64 slice device, that is 64 simultaneous detectors, there's an exposure of about 8 to 10 chest x-rays. So that to me makes me a bit nervous. And I wish I could say everyone should have it done on an EBT device, but you know what? General Electric acquired the manufacturer of electron beam devices and promptly closed out the operation for other reasons we don't want to get into, probably financial.
Yep.
And so what's happened is the 64 slice and onwards, 128, so on, are going to be the scanners of the future. And I believe that they are thankfully addressing the issue of radiation exposure now, and so there are some new technologies to cut down on exposure.
Okay.
Now, that's different from CT coronary angiography, which is a very different test. That does carry a 100 chest x-ray exposure equivalent. So I do not